Thank you for joining us today. And today I'm going to be talking to one of my colleagues who works at the practice at the Cosmetic Skin Clinic. And we're going to be talking about all things to do with social media and whether actually the influence of the social media and the current thinking about cosmetic treatment is actually for the good or the bad, or actually a bit of everything. So Dr. and I are going to be talking about that together. And we'd really welcome any questions any of you have about this, because it's quite a hot potato. It's something that people... Hi Joe, hi. I'm good, thank you. I'm just going to give you a little intro. Okay. I was just talking about what we were discussing. And for those of you who are watching who don't know Dr. Christou, she's very high-end, dual qualified doctor. So she's a qualified dentist and doctor, and has been working alongside me at the Cosmetic Skin Clinic for, is it 4 years?
5 years, I think.
5 years. Yeah. So we've worked alongside each other for a long, long time, often doing the same kind of treatments and quite specialist high-end treatments. And I just thought it'd be quite interesting to address this. Social media, is it our friend? Is it our foe? And what influence does that have on people who are selecting treatment, trying to source treatment? So I'm going to open this up now, Joe, straight away, because let's get to the nitty-gritty. What is your thinking about the influence of social media on patients who come to see you, or what's your feeling about it?
Yeah, thank you. So very big topic, and a very hot topic at the moment, because it seems that everyone has an opinion on it one way or the other. And certainly in our field, you know, it's very visual. And so a lot of people come having used social media maybe to research treatments, and there's been positive and a lot of negative as well in that. So you probably find this as well increasingly. So patients come with images they've seen, and it's either a please don't make me look like this, or it's actually I really like this, can we do something like this? And so we can incorporate that into the discussion potentially, but it's not for everyone.
No, and I think because I've been so long in this industry, it was very much before what people saw in magazines and what people saw on movies. So people came along with any kind of photography or imagery or expectations. It was all to do with something they'd seen in a magazine or television. And there were very strong trends that were coming through. I mean, Sally, I don't think many people out there will remember something called the Paris lip. I don't think you'll know what I'm talking about, will you? No. So no, sadly, I do know what the Paris lip is. And that was very much, you know, the culture of Brigitte Bardot. And again, there'll be some people listening to this who've not even heard of her. But very much, you know, there were really, really pouty lips, which of course have almost come back into that sort of current sort of way of looking. But that was very much influenced by TV. But now we've got all kinds of stuff going on social media. We've got the influence of people like the Kardashians, people that are strong influencers, and people who make their living by giving information to patients. So what do you think has been, I'm going to put it out there now, the positives, the good things that social media has perhaps brought to our patients?
Yeah, and I want to just pick up on one thing you said there before I answer the question, is the clear distinction between those who are influencers and those who are actually medically trained sharing information, because there is a difference between those two things. And I think actually that can be quite confusing for people, but we'll talk about that as part of the negative. So the positives, well, as you said previously, people would see things in movies and in magazines. Well, what social media has allowed us is a huge reach, a way to communicate with huge numbers of people. And that can be a great tool for educating and sharing information and, you know, just kind of being able to reach a wider audience in a very positive way.
And demystifying it, because sometimes it's it has been perceived as something quite mysterious.
Yeah, exactly. So we can kind of present information in a very balanced and informative way, which is actually very helpful for people, because let's be honest, most of us now go online to, regardless of the question, so irrespective of whether you're pursuing an answer regarding something cosmetically, we all go online to look for the answer without question. So it's a fantastic pool of information, as long as you know what resource you're using and whose opinions you're listening to.
Yeah, well, that's the other, and that's the other thing then, is that, you know, we can, and we'll get on to trends and what's trending and what the looks are in a minute. But so you've got the, you know, the positive information giving, which I think is great, really, really good, because people know a lot more. It can be really interesting how much people do know when they come into a practice and start to source information. But then you touched on, maybe, we're not here to bash people on social media or bash influencers, but
No.
what that isn't what we're going to do here today. It's more about sharing what our thinking is and maybe what other people's thinking is. But when you say this, obviously you have to differentiate between what, if you like, the medical information is and what maybe other information is. Can you just elaborate a little bit more on that, what you meant?
Yeah, I think influencers do have a lot of power and they have a lot of followers, and that is no bad thing. But what can be confusing, I think, for patients is that they can see that as facts that might be relevant to them, whereas in reality that's just one person's experience. And so I don't know if you found this, but some people will say, well, such and such a person has said XYZ, and that may be true for that person, but it's not necessarily true for the individual in front of you and what their cosmetic objectives are.
Yeah.
So I think there's a lot to be said for using influences to talk about different treatments.
I think that's another dimension.
Exactly. But the other side to that is the sort of purely educational tool that we as doctors will use, because we have a huge amount of responsibility in being ethical in how we present information. It has to be factual, it has to be evidence-based, and that maybe is a slightly different presentation of what cosmetics looks like compared to how an influencer's personal experience might come across.
Yeah, no, I understand that. So, I mean, and again, there is a question came up. I didn't catch all of it, but it was about, you know, influencing the young. And, you know, it was, do you think that maybe there is a duty, a responsibility, you know, generally, I hope I'm not speaking wrongly, you'll correct me, but I think social media is very much not necessarily a young person thing. That's not true. I know a lot of people on social media now of all ages, but you know, certainly social media is something that the young are very, very favoured. Do you think maybe we're influencing the young a bit too much? Are we making this kind of thing too accessible, or is it good that younger people coming through the lines actually are more well educated and can then select what they want to select? Again, it's a double-edged sword, isn't it?
Yeah, that's a very heavy question, isn't it? Because it definitely is a double-edged sword. I think on the one hand, you've got people who might be vulnerable to being persuaded towards treatment that they perhaps don't need. And you've got the whole kind of Snapchat dysmorphia, selfie dysmorphia stuff, where people get such a skewed view of themselves that it affects their personal image, because our self-identity is in part what we look like, and so I think that is definitely a risk, and as you said, very young people are able to access social media, and it is out there for them. On the other side, for people to use it in a positive way, to see what are the pitfalls and make an informed decision about treatment, I think that's a very good thing, to allow that to be very accessible for everyone. Now, of course, no person is going to get a treatment unless the doctor or you know, practitioner perceives it to be right for them. So it's not just about social media, it's about them finding a practitioner who can build trust with, build a relationship with, and kind of, you know, discuss treatments and decide what's right for that person. So if a very young person has seen something online and is being negatively influenced by that, then the practitioner who they seek treatment from should have the duty of care to that young person, to discuss it with them and to see what are the pros and cons, and should they really go ahead with treatment, and to not perform a treatment if they think it's the wrong thing for that person. And actually, that's true regardless of age. I know we sort of talked about young people accessing social media, but no practitioner should perform a treatment on anyone unless they genuinely feel it's in their benefit, because you need to put people before profit, you know. So we would only, as responsible practitioners, do what we think is right for the person, regardless of an image they've seen or some idea they've generated in their head of what they think they want to achieve.
Yeah, and I mean, somebody's come up with a comment here again. I can only see part of the comments on my page, but somebody's talking about the gist is what information, you know, on cosmetic treatment should be given on social media platforms, or should we be sharing as a basic level of duty of care? Because I will be honest, most of the stuff that we put on, you know, on social media platforms tend to be very upbeat, very promotional, very much in, you know, what's in it, what the gains can be to a patient, of course, that they are. So now we're coming back to duty of care. Now, of course, in a clinical environment, when we consult, consent, review, go through due process, we of course are following, as a medical clinic, and then other medical clinics would be following a duty of care, a proper process that gives informed, you know, so someone can make an informed decision.
Absolutely.
But on social media platforms, is that, you know, that this is a whole big conversation. But how much information perhaps should be given on social media platforms about the negatives, the considerations, all the things that, you know, people need to know?
Yeah, difficult one, because you do want to present enough information for a patient to engage in the process, but the decision for treatment's not made via social media.
No.
It's made, as you say, in that face-to-face consultation, a thorough medical assessment, and discussing things with the patient. So then, how much do we put online? I don't know. I guess it depends on a case-by-case basis. So it depends what treatment you're presenting online. And there are certain regulatory restrictions and considerations that we have to adhere to, and rightly so. And so I think presenting a very, I mean, obviously we have a skewed opinion. We feel very positively about these treatments, because
otherwise we wouldn't do them. Yeah.
Exactly. So we would present a positive view, but there are lots of resources for, you know, where things can go wrong, etc. And we need to have a very honest conversation with people about what can go wrong and how to manage that as well. Whether we would discuss that openly in social media, I don't know. I mean, I can see quite a lot of our medical colleagues are following this live at the moment. I'd be interested to see what your opinions are, and how much you present about the negative on your social media platform.
I mean, thank you. I'm going to interject here. Thankfully, you know, we've got to put this into perspective, that generally speaking, with a non-surgical procedure, the risks are very low. You know, there are risks depending on what we're performing. You know, there are obviously some techniques and treatments that we perform that are very high end and a little bit more tricky, of course, but they can give absolutely amazing results, as we know. So, you know, but having said all that, I think that it is in-house that we discuss those risks, and still non-surgery is a much lower risk in terms of assessment than, say, a surgical procedure. That's fact. So we have to sort of balance that all out. And then talking about trending, now, you know, I'm very interested in the kind of trends that are coming through as a consequence, you know, of the social media environment, amongst other things. But, you know, so you've only got to look at, again, there's strong people out there. I mentioned one family particularly, you know, there's certain things that are trending, that people really like to look like, and there's a certain look. And of course, that's very diverse depending on who you are, all kinds of things. But, you know, we've seen some really odd things coming out of treatments that have been influenced a bit by social media. So I'm going to throw out there an example. There was a very well-known young lady who went very public, actually, on the fact that she'd has her, in fact more than one, her chin, you know, there's this trend now, as we know, to get this lovely balance of features and, you know, get everything in proportion, which we've always done, but there's very much been a focus recently on the chin. There's been a focus, hasn't there? Maybe you could talk us through that and how the young are looking at that very lovely little chin. But there's been some real howlers in terms of, and it can only be best described as howlers in terms of how these beautiful young women can look if they don't get the right kind of treatment. So first of all, can we just touch on this trend that there is at the moment? It used to be lips, and we'll go back to that, but very much this trend for the chin and the, what's all that about? Explain it. I mean, I know what it's about, but I'm asking you to explain what it's about.
Definitely the trend before was, as you say, big lips, and then big cheeks came in, and then, you know, there was a lot of talk on noses, and that's still very popular too. But the current thing is jawline, it is chin, it is lower face projection, and there's been a huge kind of push on lots of different celebrities, and as you say, we won't name names, but people have become quite public discussing these treatments. And you probably, you know, you will probably echo this experience, but I've seen, as a result of that in clinic, more and more people requesting jawline definition, saying they want more projection in their chin. So it's very interesting to see how people's behaviors are being influenced by that. And I think what it comes down to is that lack of jawline definition is perceived as a very aging feature. And of course, you and I know that, because when we see...
I do know it.
I didn't think from personal experience. Yeah. What I meant is in clinic, you know, when we see the aging face, the aging patient, the primary concern is lack of jawline definition. When they talk about, you know, in the neck area or the submental area or in the sort of, you know, jowl area here, it is time and time again mentioned as one of the #1 priorities for sort of treatment outcome that they want to achieve. So we are not... And
in quite young people.
Yeah, but this
in
is
quite young
point,
people.
Is that it used to be a discussion of only the aging face, and now we're seeing much younger people who are requesting the same thing. They want more definition, they want more projection, they want more structure, because they've been influenced by social media. Now, in the young, of course, we're not looking at an age-related change here. What we're looking at is an actual structural balance on the face. So this is related to the, you know, the bones of the jaw and the proportions of the face, etc. But even people with quite strong lower face, I would say, still request more projection, more definition, more strength in the lower part of the jaw. And there's nothing wrong with that from the point of view that if you do a whole face assessment and you take a very balanced view on all the different elements of the anatomy, there are a huge number of people for whom some support in the jaw actually would be favourable. It would be more of a beautification.
Yeah, that's what I mean. It's beautification. It was stunningly beautiful. It restores balance.
Exactly. So that group of people, it's, you know, it's understandable why they would look at an image of jawline definition and think, I could do with more of that. And that's where actually you do need to go to a good practitioner, because you do need to have that whole face assessment, because there is a small group of people who actually would not benefit from it. And you've mentioned a couple of people who've gone public, and
they look like they're sucking, you know, they've got a couple of golf balls here, and it doesn't look good. It looks like an alien. But again, that's not what, but that's, again, I think what we're saying here is the obvious, really. It's selection of patient, and if it's appropriate for them and it's done well, because these things can be done quite badly, actually it should be imperceptible. It should just make them look even more beautiful, enhance them naturally. It should be imperceptible, but it should just look better. It shouldn't be noticeable particularly.
No, and by definition, if someone looks like they have had a treatment, something isn't quite sitting right on the face, because it should be entirely confluent with your natural anatomy, so that, as you say, people can't perceive that you've had a treatment. And so where these younger people are requesting more projection because that's the trend, that's the thing they think they should do, in reality it's based on an individual by individual basis. Yeah.
And the other thing I was going to bring into this is something I was thinking about today when I was thinking about our conversation, and what people look like with makeup on, and when they're styled and, you know, beautiful makeup. Again, I always see this wonderful makeup tutorials, and some of the images I see, these young, beautiful, often very young, beautiful people, you know, made up to perfection. It again, all conjured, the aesthetic work that's been done, the cosmetic looks can look absolutely stunning, showcase it beautifully. But when you take the makeup off,
Yeah.
And you look at people who've had, you know, maybe done a little too much, or not necessarily too much, but maybe not quite, it's not quite in balance.
Yeah.
When the makeup comes off, it actually is much more obvious that it doesn't look very good. It's a bit like, and because you're a dentist as well, Joanna, it's a bit like when people have a lot of dental work done, or dental veneers, or you know, crowning, and it looks absolutely stunning when they're made up. I mean, absolutely beautiful. But when you wake up first thing in the morning and don't look quite so good and not made up, the teeth can look quite obvious in a face that's not made up. Would you agree with that?
Yeah, so this comes, well, first of all, it's great that we have makeup because it covers all manner of evil, but and that's a wonderful tool to use. But everything, we would rather prefer it look natural, so you don't have to use a lot of makeup to cover up. And so you and me both, Tracy, we don't wear much makeup. We keep everything quite natural and quite light, and that's because we respect.
I'm getting older.
Sorry?
It's because I'm getting older, and actually wear more makeup as you get older. It doesn't look good, but yeah.
Oh, okay. So I'll be wearing zero in a few decades.
Yeah.
No, what I was saying is you need any treatment you do to respect the underlying anatomy, to kind of, you know, preserve it and restore it, and not distort it, because you want to look good with your makeup, yes, of course, but also without your makeup, for sure. And part of that is having good, healthy skin. So it's taking all the different layers one by one and addressing each of those things.
Yeah, that's a really good point. And again, we focused on this and on a couple of Instagrams ago with Tara, as you know, one of our nurses. We were talking about the importance of really healthy, glowing skin, because that showcases everything we do as well. And I think what's good about social media too is that they do focus on a lot of skin and, you know, healthy skin and how to look after skin and technologies, which I think is great. Again, lots of information sharing.
Yeah.
So again, going back to trends, and you know, there was the trend for big lips. And again, there have been celebrities at the moment who've gone, one young lady who again had all her lip filler dissolved and looks stunningly beautiful, even more so as a result. She looked lovely before, but even more lovely now. And again, that trending that was on about, you know, a lot of lip, do you feel that's still strong on social media, sort of the big lips? Or is it more now on that subtler lip that's much more appealing and more beautiful?
I think the overdone lip look has gone now. I think it's certainly petered away, and I am pleased about that, because I do not like that look at all. And so I think things have become a bit more sophisticated now. People generally do want a lot more kind of understated, has she, hasn't she kind of a look. And I think social media has a part to play in that, being the emerging trend of aesthetics. That, and doctors saying, well, actually, isn't it better to do it this way, and having those conversations with people. So certainly I think the move is much more towards that kind of less is more approach.
Yeah, which is good, because again, that information is coming out. And the other thing, again, you know, I think of all the names that are given to things. You know, everyone sort of likes a new trend. What's new? What's new? And what's new isn't necessarily what's better. I think I would say that to patients. People say, what's new? Talk about what's new out there. You know, what's new. And sometimes new is great. Sometimes new is very good, and sometimes the way we do things and the technologies and the techniques we use is better. But sometimes it's not, and sometimes, you know, that's why it's only my personal choice. I've never jumped on a bandwagon too quickly. I've always sort of assessed it, seen how it does, seen what people do with the technology particularly. But this trending about, you know, if you remember back in the day, you know, treatments where we use muscle relaxants, and we still do, we love all that, but where you know, people getting very hyper elevated eyebrows, again, it's one of my pet hates. But again, that trending to keep that sort of relaxing treatments on the upper face very natural, so that the eyebrow orientation's very, very beautiful, still arched but not over elevated. All that seems to be coming through on social media as well. Would you agree?
Yeah, absolutely. So, I mean, we have to be careful on social media talking about
I know.
certain treatments, but yeah, there is definitely, you know, there was the whole boy brow thing, which is a much more kind of flatter, lower set brow, and there are changes in perception of what is beautiful and what should be looking natural, etc. But I certainly agree. I would sort of echo your thoughts on not jumping on the bandwagon of trends as they come and go, because you need to let the dust settle. You need to sort of allow things to prove themselves before you start doing it. And we certainly don't, you know, adopt new things just for the sake of it. We really look at the research and try to understand, well, what is right and how is it working, and are there any risks here we need to consider before we you know, before we as a clinic take anything on anyway. This is one of the negatives, I suppose, of social media, is that we see so much influence in people taking up different trends and asking questions about that, as you say, we don't want to forget those tried and tested, you know, the kind of bread and butter of what the face is in terms of its anatomy and what the aging process looks like, and therefore what is needed in order to preserve that and restore that. Now, aesthetics is a huge growing field of medicine, and there are always new things coming through, and there have been some great breakthroughs in the industry of late. And I would sort of say Profilo is probably,
yeah, I agree.
You agree with that?
Yeah.
So there have been some wonderful things that have been genuinely new and kind of disrupted the industry that we have loved and embraced and taken on board in part of our sort of care of patients. But I would say those are once in a blue moon. Very few occasions do we see a trend that shakes the industry, you know?
Yeah, there are some game changers.
Absolutely.
And, you know, there are game changers, ones we've known in the past, things we can't talk about on social media, but certain treatments that have changed the whole way we treat a patient's face. And I think the thing is, and we tend to know what they are, and we tend to advise our patients accordingly. I think the most important thing I would say is that just because something's a trend doesn't mean to say it would look good on every face, which is the obvious thing to say. I know that, but sometimes obvious things need to be said.
Yeah.
You know, sometimes the trending treatments, and you put that on a beautiful girl or young woman, and it just doesn't look right. It's a bit like trying on, again, I'm going to simplify, but it's a bit like, you know, you can put a dress on one young person and it looks absolutely bang on. You put that same dress on another equally gorgeous person, and it just doesn't do anything for them. And we all know that just by going into changing rooms every day of our lives. So actually, just because something's trendy doesn't mean that it's right for that person. It's all about beautifying a face, and working with a face and working with a patient is all about keeping everything in balance. As I've always said, if you slightly overemphasize something or slightly throw the balance of a face off, it can take a very, very, very beautiful person, really attractive, stunningly attractive person, to look off, slightly not quite right. But having said all that, excellent aesthetic medicine with a good eye and a good visual can take somebody to the next level. It can just look so wonderful, so understated, but so stunningly, you know, beautiful, whether someone is in their 30s, 40s, 50s or 60s. You know, I was smiling with my daughter the other day because actually she was talking to me about somebody who was talking about cosmetic medicine who's in their 90s. So, you know, brilliant. It's accessible to all, but I think ultimately, I think what we're coming to the conclusion of, and I think what most people out there would say, is that it's not a friend or a foe. I think it's an information that we're gleaning. Some of it's confused, some of it's skewed, some of it's a bit disjointed, but overall, I think it's opened up a dialogue and it's opened up information to huge numbers of people.
Yes, and I would definitely agree with you there, where it's a brilliant source of information, but everyone is individual. Everyone should preserve their features and not use the trends of the time to influence how they perceive themselves or influence what they want to achieve overall. It's definitely a good trigger for discussion, and it opens up a discussion both electronically, you know, digitally on Instagram, etc., but also in the clinic as well. It's a great tool for opening up discussion, but the trend doesn't necessarily suit that individual. And that again comes down to the doctor-patient relationship, building a relationship with a practitioner you trust, so that you know that they're going to give you the information that's right for you as an individual, for your face and for your aesthetic goals.
Yeah, I think that's put beautifully. And finally, is there anything else? I mean, that was put absolutely bang on the money. But finally, are there any things, you know, anything you actually have a big beef about on social media? Anything that you feel really gets your goat, or anything at all that you feel is really, or even positively, any big trend or any big treatment or any bit of information that you think has either been great or awful?
I think one of the real pitfalls is photographs that have been altered. And you do get people looking at pictures of, I don't know, for example, really beautiful tear troughs, absolutely perfect, no shadow whatsoever under the eyes. And then patients come into the clinic with these images saying, make my eyes look like that. And actually you can sort of see the penny drop sometimes when you say to people, well, that photograph isn't real, that's been altered. Now let's have a discussion about what is real and what can be achieved. And then you have a very kind of nitty-gritty conversation about these are the amazing things we can do, and this is what it's going to look like. But if you want to look like that photograph, go and just put that filter on your own picture and then you'll achieve it, kind of thing.
Oh,
so
yeah.
you have to challenge people sometimes. But I think that's my biggest bugbear, is the dishonesty that people have with pictures that they post and kind of altering them, and what that then does to influence people in what they perceive as real and right. So that would be the negative. If I was to look at a positive, I would say it's a fantastic educational tool. We can have conversations and reach people in a way that we've never been able to before. I mean, this lockdown has given us a fine example of how well connected digitally we can be, actually, because I don't know about you, but I'm talking to friends from the other side of the world who I perhaps wouldn't have been able to connect with. And so the digital world does, you know, bring us together, not to sound corny or anything, but it's a great tool for communication, for education. And I think that's a fantastic thing that we've got accessible for us.
Yeah, I mean, I would agree. I mean, I think overall it's great. I mean, there have been some people, you know, offering different kinds of information on here. But, you know, there's so much we can do now to restore volume, restore, beautify, enhance people's lives. And again, finally, perhaps the point I'd like to make, and I make this a lot, is that, you know, far be it from just being perceived sometimes as, you know, something that only sort of vain people do, vacuous people do, people that are just self-obsessed. I think in my experience with patients, that's not the case. I think and I can only speak for my own personal experience and my patients that I've seen and people coming through the door, it's anything but that. Most people are very, you know, balanced, very busy, lead busy lives. I say this a lot, you know, they have a lot to their lives, have a huge life, but actually just having a bit of treatment actually makes them just get on with their day better, and it, you know, just it empowers them and makes them feel a little bit more positive in their day. And if it does that, and then that is a very good thing. You know, I appreciate there can be some negative things, but if it does that and it enhances somebody's life, enhances the way they feel, and adds to their, you know, their well-being, fantastic. And that is hopefully what we're all striving to achieve every day that we're working with these patients.
Absolutely. And I can't remember whose quote it is, actually. I'm going to look like a right muppet now, but there's someone who said, if you look good, you feel good. If you feel good, you do good. And I just love that quote, because actually it's true. This is about well-being, isn't it?
Yeah, I like that. And on that very positive note on social media, I will call it quits, because we've been talking now for 35 minutes. Jo, it's a pleasure. I see you in clinic all the time. Your treatments are fantastic. Patients love you. Thank you for giving me your time today. And I hope to people that are watching, it was of some interest. At least it stimulates a bit of conversation. Thank you very much indeed, Jo.
Take care, guys. Have a good day.
Bye. Bye. Thanks for watching. Bye.